And we're talking about some new research that's come out. Now, we've seen developments in cancer treatment have made a tremendous difference to what a cancer diagnosis means in today's day and age. And there's a promising new breakthrough that has healthcare professionals excited. Pancreatic cancer is a type that's been especially deadly, particularly difficult to treat. It is notorious for advancing silently, showing symptoms only when it's already reached a later stage. And looking here at the UAE, according to figures from 2023, the UAE's National Cancer Registry recorded 147 cases of pancreatic cancer. That's actually up from 110 cases in 2021 and then 55 cases that were reported in 2019. So we're seeing quite a rise there here in the UAE on pancreatic cancer diagnoses. So promising developments from global trials could signal a turning point when it comes to some of these cancers. Researchers are currently testing a novel, what they're calling an off-the-shelf vaccine that targets a specific mutation that's found in a lot of pancreatic cancers. And early results show it's been quite effective at boosting immune response and preventing recurrence, which is an important aspect. Findings that were published in the journal Nature Medicine have revealed that in an early trial featuring pancreatic and bowel cancer patients, this new injection appears to be capable of slowing progression of the disease and also boosting survival rates. So to find out a little bit more about this, we're joined now by Dr. Sadir Jumaa Alrawi, who is a surgical oncologist in Dubai. Dr. Sadir, thanks for joining us.
Thanks for joining us today from Dubai. So the question is about the novel treatment of the pancreatic cancer, right?
Yes, so we are going to be talking about this particular development. In fact, tell me a little bit about what we've learned from this research and how this particular jab works.
To start this topic, we really go backward to see what is the milestones in advancement in the pancreatic cancer. As you said, pancreatic cancer is a deadly disease, and that deadly disease usually diagnosed either with major symptoms or advanced. So there are three parts of the problem: metastatic, which is very advanced; local regional, which is locally advanced; and early treatment. However, we have other thing is to prevent recurrence and to prevent progression of disease. In the past, we are used the three major objective of treatment, which is surgery, chemo, and radiation. Recently, we start going on milestones about immunotherapy and certain checkpoint inhibitors and certain type of prevention of a mutation. Now, this is a new development in nature about vaccination. We aim vaccination to cure, but up to this point, we don't have the cure. We have stop progression, prevent recurrence. So at least we get steps in the management. These are immune tablets or injections that can boost your immune system to protect against cancer or progression of the cancer. That's improving survival. With the increased number of the cases, we found improving survival rather than survive. The general for pancreatic cancer, the 5-year survival, only like about 1 year. That's a max, even with a different type of treatment. Now we're getting better and better and better. So that is the point of the research: boost immune, prevent recurrence, slow progression. Up to now, these are the trials. We haven't reached the trial about success or prevention 100%.
And let's actually talk about that. What happens next? These are phase 1 results. What is the next stage in the process? How long does the development of something like this usually take before it might be available finally to patients?
So there is every research go through phases: phase 1, phase 2, phase 3. Phase 1 usually might be in the animals and some volunteers. Phase 2 might be in really good volunteers that fill the criteria. And phase 3 might be open to the public. And then after that, once that's approved, FDA approved, we will go to the usage. Then in the United States, it's difficult to use it because you need long-term FDA approved. In the Europe, easier because it's CME approved clearly. In the other countries, like some Middle East, although we depend on these trials, but we can really import the drug and we can use it based on the recommendation of the quality of that country, whether UAE, Iraq, or Saudi Arabia. it should be some legislation to use or not use. But availability should be soon after finishing the third phase trial.
And let's get some background now on pancreatic cancer. Why, you mentioned there, it only usually is detected in later stages, but why is it so fatal once we finally do detect it?
Two things. The position of the tumor in the retroperitoneal, it's a sausage-shaped organ in the retroperitoneal. The head part, usually, if it is called jaundice, it's early detection, but sometimes even less detection because it's obstruct the common bile duct. The middle part is caused usually back pain because of the celiac nerves involvement, and that causes back pain. However, in the tail, it will go unnoticed, and that's the most dangerous because it go big, metastasize to the peritoneum, metastasize everywhere, and nobody knows about it because there's no vital organ that can give me any details. Patient usually goes unnoticed, change in weight, especially now with the age of Manjaro and Ozempic. People get injection, they think they are losing weight because of that one, and some of them, there might be some underlying like malignant condition like stomach or the pancreas. Second thing, the other part, it is the difficulty of it, although the position, the symptomatology is not very clear, like stomach, you get vomiting, nausea. This may have non-specific weight loss and pain. That's the only thing in it. And once it's diagnosed, the biology of the tumor is very aggressive compared to the biology like of the thyroid cancer, breast cancer on this one. Aggressive tumor. The old data, the 5-year survival, not more than 1 year or between 6 months on and 1 year on average course of the pancreatic cancer.
I guess given all of that, given how difficult it is to detect, you mentioned how vague the symptoms are. I was looking at that as well, and I just thought, okay, tummy or back pain, unexplained weight loss or loss of appetite, that can be for almost anything, you think. What eventually points doctors to look at the pancreas, and are there ways to actually screen for this a bit more preventatively that the medical professionals are starting to look at?
That's a good question. So when people getting, the way we found it, most likely patient have non-specific abdominal pain, weight loss, and persistent pain, despite all the preliminary medication has been given, we will consider CAT scan. CAT scan usually can see about 70 to 80% of any pancreatic tumor. And then we go to the MRI, endoscopic, and the biopsy. But these are only after certain time of a treatment. And people most likely get frustrated that I'm suffering and nobody knows how to diagnose me. So these are the points which is diagnosed. Now, about screening, there is no proper screening program for the pancreatic cancer, except in families they have pancreatic cancer. If a patient have his father or his mother have a pancreatic cancer, we consider them for screening by doing a tumor marker CA19-9, which is a blood test, very simple and cheap, or by doing endoscopic ultrasound in certain cases. But that's according to Johns Hopkins criteria, not a standardized care to handle that part. So there is no proper screening like a breast, prostate, lung, and thyroid screening program for the pancreas.
Dr. Sadir, thank you so much for giving us some insights onto this topic.
Thank you. Welcome, and then more than see you in the future, inshallah.
Definitely.
Thank you.
See you. Dr. Sadir Jumaa Alrawi is a surgical oncologist based here in Dubai, telling us a little bit more his thoughts on this potential development in cancer treatment, especially with pancreatic cancer, the possibility of a vaccine really to help stop reoccurrence in these particular cases.